You for coming to this hospital lead meeting for Surge Week 2. Thank you all for your interest, your collaboration and your hard work to date. The outline of what we're going to discuss today is the background to the study and the aims of it and what Surge Week 2 will entail. We'll discuss where we are to date in terms of the registration and the role of the hospital leads, which you've all kindly agreed to fulfil. We'll discuss then the next steps. The key one currently is the co-lead registration, and later it will be the mini-team format, so we'll go through that. I hope today that this presentation will take less than 10 minutes, and really the hour session is to provide an update, but also to bring everyone together and offer a forum for discussion and questions. We intend to hold these meetings every couple of weeks in the run-up to the study. And in the interim, if you do have any questions or issues, please feel free to reach out to the joint mailbox, which I'll put on the last slide. So some background: we know throughout the world there's over 300 million operations happen every year, but the data produced from this is of varying quality. Despite this, we think about 50 million people experience at least one post-operative complication a year, and 3.5 million adults die every year within 30 days of their operation. Some evidence suggests that half of complications are avoidable. So what Surge Week hopes to do is to look at the global variation in post-operative complications throughout the world, and the secondary outcomes cover most surgical specialities, as this is a pan-speciality study. Looks at particularly global variation in post-operative infective complications and additionally antimicrobial resistance rates. Looks at who dies after operations, the variation in this and why people might die after operation. Think of it as a global mortality and morbidity meeting. We'll look at the variation access to and the outcomes from minimally invasive surgery, including robotic surgery, and the variation in delivery and outcomes of the bellwether procedures, which we know are used to map health systems throughout the world, and they include laparotomy, C-section and open fractures. We hope these objectives not only answer important questions globally, but also a pan-speciality in their nature, so allow all specialities from throughout the world to participate. Locally, this data will allow hospitals to benchmark their outcomes either against national or global comparators. Nationally, it will inform priorities for advancing safe surgical care in your country, support policymakers and surgical associations to target things that are likely to improve outcomes for your patients. And globally, it will identify those at highest risk of post-operative complications and death, and therefore inform the design of future interventional trials. So as with similar studies, Surge Week 1 and other global surgery unit studies, it's an international prospective multi-centre cohort study. Anyone delivering surgery throughout the world can participate from all surgical specialities, but the key is you must have local approvals in place in order to collect and transfer the data. This will need to be evidenced onto REDCap before we are able to give you the mini-team logins. Data is collected for 30 days following the operation, and there's no change to routine care. You do not need to call or follow up patients outside what you would normally do for patients, and the data is collected from routine health records. There are 6 one-week periods, and we hope that you are able to collect data for each of the periods, and they run from the 31st of August to the 11th of October with a 30-day follow-up window. The time starts at 0000 in your hospital, so whatever time zone you work in on the 31st of August or whichever period or periods you choose to participate in. To date, we have over 10,000 clinicians express interest in being part of Surge Week 2 from over 2,000 hospitals in 131 countries. You can see from the map that it's essentially all blue, which is phenomenal and truly down to all of you for your hard work and help in disseminating this throughout your networks and countries. So we thank you all for this, and we hope that this is a promising outlook for how the study will work. And the study hasn't closed yet for expressions of interest. So if you do have colleagues or other hospitals that are interested in participating, please ask them to sign up through the expression of interest link. It's the same link regardless of which role you want to fulfill in the study, whether you want to be a hospital lead, a co-lead, a collaborator, and whatever grade you are or speciality, you all complete the same link. And this is open to not only doctors, but nurses, research nurses, PAs, ODPs, medical students, whoever you wish in your hospital to be part of this are more than welcome to participate. In terms of the structure of the study, in each country there are one or multiple national leads who have selected you as hospital leads to lead your study in your hospital. Your role as hospital leads is you're responsible for securing local regulatory approvals, which, like I said, will need to be evidenced onto REDCap before we provide mini-team logins. And at the end of the study, you'll have to complete a hospital site survey. The current phase of the study requires you to select co-leads, which we'll go into in a bit more detail in a second. And then your co-leads with you will have a REDCap page that will allow you to select your mini-teams. Again, you'll only be able to select people that have completed the expression of interest link. So I'd encourage you to spread this widely amongst your teams so that when we come to registering the mini-teams, everyone is already uploaded to your dashboard. Within each hospital, there can only be one lead because we need one person to take responsibility for the approvals and completing the site survey. But there can be as many hospital leads, co-leads as you wish there to be. And we've left that up to hospital leads really because each hospital will differ in terms of its setup and the specialities participating. But we would suggest as an easy or simple way, you could maybe have one co-lead per surgical speciality participating in the study. Additionally, if you don't want any co-leads at all, that is totally fine. They're there really to support you in the running of the study and running of the mini-teams. And each mini-team will consist of 3 people, and these will collect data on consecutive eligible patients for their specialities. They can choose to collect data for one or multiple specialities for one or multiple time periods. So clearly in big hospitals, there can be multiple mini-teams collecting data across surgical specialities and time periods. The key thing is that these periods or specialities do not overlap so that the same patient isn't uploaded twice into the database. And if the hospital lead or co-lead wants to collect data as part of a mini-team, then they just need to make sure they select their own name in the mini-team portal, which will be the next phase of the study, which is currently not live. And that will ensure that we give you the correct access on REDCap. We'll hold another meeting before then to update you on how to do this. So to summarise the hospital lead role, secure your local approvals, select your co-leads, your username will have been sent to you and it end in .sw or .sw2. For those of you that have participated in multiple studies, you're likely to have multiple usernames. For example, the alligator one ends in .app. So just check that you're using the correct username. And if you can't find your password, check in your junk or just email our joint mailbox, which I'll put on the screen on the last slide, and we can reset your password for you. Select the mini-teams with the support of co-leads, which will go live soon, and encourage all team members to register through the expression of interest link, which is here, and I will send out in an email to ensure that everyone has it. So the co-lead registration I'll go through briefly, but my colleague Cortland, who's one of the fellows here at the University of Birmingham, has created a YouTube document and also a PDF of how to do this, which are hopefully relatively straightforward. But if you log on, you'll click on co-lead selection pending, and you'll see that there are a number of records. And these records will only appear if someone in your hospital has expressed an interest for participating in that speciality. So for example, if they've expressed interest for general surgery and ENT, then you'll see them. But if you don't have anyone for neurosurgery, you won't see the neurosurgery box. If you then click on the blue underlined part, you'll open this next page here, which you can see is for general surgery, and there are 5 different options in this hospital for people who've expressed interest in being a co-lead, and you can select as many as you wish. Once you click one, it will open the next box of co-lead 2 and so on. And if you just press complete to change incomplete to complete and press save, you can then move on to the next speciality. And if you do that for all the specialities that you wish to be part of the study. The mini-team selection will come next, but just as an introduction to what we expect this to look like, this would be the ideal model. You would get a team of 3 people that would collect data for one speciality for all 6 time periods. It means that all the surgical specialities are covered and for all of the time periods, which gives you a wealth of data, and also lots of people collecting data for the study. Clearly, in some hospitals, you don't have all of the surgical specialities. So in which case, then you just choose to collect data for the ones that are relevant to your hospital, and you can collect data for all time periods. Now, clearly, in some situations, and hopefully, hopefully this happens frequently, that we have more collaborators than we need, and in which case you can divide your teams up so that collaborators just take data for certain periods. So you can see here team A is collecting period 1, 2, 5 and 6, and then team D is going to do 3 and 4 for general surgery. So you can divide them up so that we allow everyone who wants to participate in your hospital to be part of it, but also collect all the data. The less favourable scenario is the one here where you maybe have lots of specialities but maybe not enough people to collect data, and we recognise that this is a limitation of doing a study like this in hospitals throughout the world. And what we suggest in this scenario is that you try to collect data for as many specialities as you can across as many time periods as you can, and you can choose which ones that you participate in as demonstrated by the diagram, and these diagrams are all available on the website with a full PDF explaining this. So the key things: register, get everyone to sign up through the link. You collect data for 6-7 day periods later in August through to October. 30-day follow-up with no change to routine care, and everyone who collaborates and submits data is eligible, will be listed as a PubMed citable co-author on resulting publications. So the key next steps, we've been through this, so sorry to labour the point. Local approvals, ensure they're in place. They'll need to be evidenced on REDCap. Select your COLEs via REDCap and encourage people to sign up through the link. All of the documents for the study can be found on the website through this link. We've got a number of social media pages that will provide regular updates, and we hope to provide regular updates as the momentum to the study builds, as it's only 4 weeks or so away now. We have a weekly leaderboard of registrations per country, but also per country's capita, which updates every Monday. And if you do have any questions, please feel free to contact us on the link. Before I open the floor to questions, I would just like to say a massive thank you for all of your interest and your collaboration in the study. The number of people that signed up is truly phenomenal, and this has the potential to be one of the world's largest studies on post-operative complications. So thank you, and we're really happy to have you all on board, and I'll now open the floor to any questions.